the computer. All right. Yay. I think we're recording. I think we are. Yes, I think we're recording. So weird. Yes, we are. Okay, great. So, hi everybody. Welcome to Rebel Queen Spotlight. Yay, it's that time again. I really look forward to interacting with the queens who are my special guests, and today I am really excited to share, for the queen today to share her story and her journey during her birthing experiences. So if this is your first time bumping into us on Rebel Queen Spotlight, welcome. We do this every single week, every week. If I'm not here one week, it's because something happened, because this is not something I do out of, oh, I have to do this. It is absolutely something I look forward to. Yeah, it's actually like the highlight of my day. So if I am not doing it, it's because something's happened and you all need to pray for me. So, I'm Nikki Inman with the Birthing Code. That's the sign behind me, the Birthing Code. My son did that for me. I'm very proud, but I won't stay there. And I help queens to overcome their fear of birthing and heal from their traumas and any generational wounds that are really stopping them from showing up as their best, so that they can manifest the type of birthing experience that they desire. And if you would like to follow us, you can find us over on IG, Facebook, YouTube. If you miss any of the episodes and you want to catch up, YouTube is the place to go to catch up. And I am also currently on Clubhouse, and all of those places you can find me at the Birthing Code. I kept it simple, just at the Birthing Code, wherever you want to find me, at the Birthing Code. So if you have any questions, or you want to learn how to work with me, how to work one-on-one, or you want to find out about my courses and my coaching, you can DM me over on Facebook or on Instagram. Okay, I guess I should do like a mini introduction of myself, especially for those of you who are meeting me for the first time. So I am originally from the UK. I was born there. I moved to the States when I was 16. So I've actually been in the States longer than I was in the UK. So yeah, I've been in the States for 30 years. I am mother of 8. I birthed 5 of those 8, and I was gifted with 3 through marriage. I am married to an absolutely amazing, amazing king who supports me and is my absolute biggest cheerleader. And I am so very grateful. And I am also a plant-based chef. So I also help women and kings, well, I shouldn't just say women, queens and kings, to transition their lifestyle to a plant-based lifestyle if they are seeking to conceive, because we underestimate the role that diet plays in how our bodies are prepared for birth, and how ultimately as women that affects our birthing experiences, and also affects the quality of our eggs, and for the men affects the quality of their sperm. So I do coaching, helping people to transition to a plant-based lifestyle. So I think that's it. I don't want to drone on about myself, because this is not about me. It's actually about my guest today. So I'm going to allow my guest. You guys know I have a thing with pronouncing names, and I hate messing up people's names. And so I am going to pass this over to my guest so that she can fully introduce herself and tell us a little bit about herself. So welcome. So happy. Thank you for being here.
Thank you.
Share your story. Absolutely. I mean, I get a front row seat. I'm going to start bringing popcorn to Rebel Queen Spotlight, so that as I'm listening to the stories and all my snacks, I have my drink. No mason jar today, guys. Today we're drinking cranberry juice, and I don't have anything in there, I swear. Awesome. Okay, I'm sorry. Take it away. Tell us, introduce yourself.
Okay, give me just a second.
No, you're
okay.
You're good.
All right. Hi. My name is Sanpri. Last name is Purdy-Porter, so it's hyphenated. I'm originally a native of Atlanta, but raised mostly in Florida. I'm 39 years old. This year I'll be 40, and I'm very excited about that.
Happy 40th birthday.
Yes. I'm a physical therapist in a hospital setting. And I have 3 kids, 2 boys. They're 13 and 6, and then I have a little girl who's 2.
Aw.
And married to my great husband, who has been a very big supporter, especially when it came to breastfeeding, which is a whole nother journey.
Oh.
So, and we've been together for 21 years and married for 15
Hey,
years.
that's awesome. 21 years when?
So we met in college. So we met in 1999, so almost 22 years. But we got married. We've been married for 15 years.
That's awesome. 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 Yay. Okay, so how long have you been a physical therapist?
I've been a physical therapist for 15 years.
Wow. Do you love it?
I do. I love what I do. I don't necessarily like healthcare. I don't know if that makes sense.
No, absolutely. Yes, it makes
I
sense.
love helping people, but I don't like the healthcare system.
The red tape and the bureaucracy and the paperwork and all that comes with that. Absolutely. I used to work in the hospital system, so I know exactly what you're talking about.
Yep.
Awesome. So what type of, like, I know that there are different practices within physical therapy. So what is like your, what's your area?
So I work at what's called a long-term acute care facility. So we basically are kind of like a step-down hospital where we deal mostly with patients that are trying to come off ventilators. We deal with patients with complex wounds, with very involved infections, things like that. We are dealing heavily with COVID patients that are now kind of in the post-acute phase. So they're still very sick. A lot of them come to us on ventilators, and our job is to try to help wean them off the ventilators and get them a little bit stronger so they can either go to the next stage of rehab or go home, hopefully.
Okay, awesome. Wow, that's some heavy duty work that you're doing. That is some stuff. Oh, before I move on to my next question for you, tell me about your name. So when I hear your name, what I think of, I have East Indian heritage. My great grandmother was East Indian. So when I hear your name, I'm going to be honest, all I hear is East Indian. So tell me about your name.
Well, it's a funny story about that. My parents, they were watching the Tour de France or something the year I was born. And I guess one of the cities that they were biking through was called Sanpri. It was in France. So my parents shortened it to Sanpri because I had a sister named Caprice. So they thought, well, it would be, people would get us mixed up. People still got us mixed up. It didn't make it any better. But that's basically where it comes from. It's French origin.
Okay, look at that. I was like all the way off. It rings to me like Indian, like Sanjeev or yeah.
I get that a lot, and I actually kind of did like a Google search on my name, and I actually met one girl on Facebook with my name. She was from India.
Yes.
However, her name was a combination of her mom and dad's names, which was interesting.
Wow. Okay. All right. So what's your last name?
It's Purdy, so Purdy, and that's a French last name. Don't know who I got that from yet. And then Porter, my married name.
Married name. Oh, okay, awesome. Okay. So let's so I think so our viewers have gotten to know a little bit about you. So let's talk about, so you've had 3 births. Your first birth, your son is 13. So tell us a little bit about that. Like overall, how have your birthing experiences been? You've had 3.
They've been interesting. So overall, when we first moved we decided to have kids about 2 years after we got married, and I found my gynecologist through my primary care. Loved him. He's a white gentleman. But he was great. When we had him, I went up to like 41 weeks, I think. And he was like, well, at the time, I was only given the option to induce. So I was like, okay, I tried to wait it out. He was 9 days later than his due date. And I was just like, okay, we'll do this. And the induction with Pitocin and everything, it was just really stressful. It just caused, the contractions were horrible. And then I got the epidural, but it caused my heart rate to drop and caused the baby's heart rate to drop, which prompted them to do the C-section. So, I wanted to save my life. I wanted to save the baby's life. So he ended up being a C-section. Overall, I recovered well from it. I didn't have a problem with recovery. I was actually able to go back to work sooner than I wanted to for financial reasons, but I recovered enough to go back within 5 weeks. And
5 weeks after birth?
5 weeks after birth.
Wow.
Yeah.
I can't even imagine. I cannot even imagine what that was like.
Yeah.
That's making me teary right now.
Yeah, because I had just started that job. They actually hired me while I was pregnant. And I didn't, we didn't have enough saved up for me to be home longer than that time. So 5 weeks.
Wow. How was your postpartum with that pregnancy?
I didn't have, with him, I had a little blues, but I didn't have full on depression or anything like that. Just a little baby blues.
Probably from having to separate from him so soon.
Yeah. I was lucky enough that my parents were able to come and rotate, coming to stay with me. So he didn't have to go to daycare right away. And so that helped, but it was still hard.
Yeah. Yeah. Okay. So 7 years later.
Yeah, just about 7 years later, me and my husband actually decided to tried to space them out. I don't know why we decided to do that. But, yeah, so got pregnant. I actually had a miscarriage before that, the next successful pregnancy, which happened to coincide with when my father actually passed away. So I was going through that and having a miscarriage while I was trying to bury my father. Wow. But we ended up getting pregnant like really quickly after that. But that pregnancy went well. I had just lost like 80 pounds prior to that pregnancy. So I was in really good shape. I was exercising, eating right, working hard, just going along with that pregnancy pretty well. But then probably my last checkup, which was about 2 days post my due date, I go in, I see a fill-in doctor, wonderful Black lady named Dr. Jones. And she's looking at me. She's like, okay, looking at me, I'm swelling and all this stuff. And she's like, honey, I think something's going on with you. And turned out I ended up having HELLP syndrome. And HELLP syndrome, I can't remember the whole acronym, but it has a lot to do with your platelets being low. It has a portion, preeclampsia is a component of it. And I had been feeling fine, but turned out I was having some vague symptoms, and I just didn't know. I just thought it was a part of the pregnancy. So she was like, well, I know you want this VBAC, but I'm going to try to make it happen for you because my hospital was VBAC tolerant. But if anything happens, we're going to have to, do whatever is safe for the baby. So what she did, she stripped my membrane and caused me to go into labor. So I went into labor that night. I did end up getting an epidural. So I was comfortable for the most part. And when the baby's heart rate would drop or something like that, they just flip me over. Yeah. They just flip me over. And then probably about after 8 hours, she was like, okay, you can push. So I pushed, he came out. He was small, I think, due to the HELLP syndrome, even though he was full term. So he was like 5 pounds, 13 ounces. But they kind of whisked him away because his blood sugars ended up being low. So that the birth itself was okay. Everything after the birth sucked because he had to be in NICU for about a week. I got a spinal headache from the epidural, so I couldn't hold him. And the doctors were saying, oh, well, you may have to go home with like this. And I was like, I can't. I have 2 kids at home. How am I going to take care of myself? And I can't even hold my head up. I couldn't even breastfeed him because I couldn't even hold him. It was so much pain. Wow. So finally, a nurse suggested, oh, well, you can get what's called a blood patch to help clot it off. But I had to wait because my platelets were still trying to get to a safe level, and they didn't want to do that and cause me to bleed out. So we were in the hospital. I was in the hospital for like 5 days, and my baby was in the hospital for like the whole week. And then we were able to come home after all that drama.
So how many days did it take? Like, I know you said you got a spinal headache. How long did it take for you to be able to get past, you know, for the spinal headache to dissipate?
When they did that blood patch, I had immediate relief because it clotted off the leak in immediate relief.
Excuse me.
And this is where I was glad that I advocated for myself, because they were trying to send me home like that. Not telling me the options, you know? So I was like, you got to do something.
That's crazy. Yeah, because it was like only after you said, no, I don't think, listen, that's not even a solution. Like, I can't do that. Then it was like, oh, okay, well, we do have this option. Like, what the?
Yeah. Yeah.
Wow. Okay. Wow. Yeah. All right. So, so you had, you know, your previous 2 birth experiences for with your 2-year-old, your little girl. Wasn't that so cool? Like, okay, I do want to talk about this. Did you notice a difference between carrying boys and carrying your daughter?
Yes. So my little girl was not planned. We were 2 and done. So, however, you know, I had previously been on hormonal birth control for years. Mm-hmm. And then I decided after my second child, it's like, I don't want to do this anymore. I don't want to put hormones in my body anymore. I'm done. I didn't have any problem with it. I never had any complications. I was like, I'm just tired of it. So we started doing natural family planning, which was working great until it didn't work. So 4 years later, we get pregnant with this little girl. And I knew that she was a little girl because I was sick as a dog with her. I wasn't sick with my boys. My boys, I never threw up. I had like a little bit of nausea here and there, but the first 3 months pregnant with her, it was rough.
I have a theory with that because I went through the same thing. Like my first 2 boys, pregnancies were just so easy. It was just so like, ooh, floating on air. And then I got pregnant with my daughter. And I swear, man, I mean, I always had nausea in my first trimester. But then it was like, this nausea then went to like full on, like throwing up. And I was having these, oh my gosh, these migraine headaches that were out of this world. I mean, my migraine headaches were so intense that I would lose my peripheral vision. So it was almost like I was in a tunnel. And then this side, the right side of my body, I would lose feeling.
Oh, that's scary.
Yes, while the migraine headache was coming on. And it would start with, I would see like lights, like little lights. And I'm like, oh God, it's coming. And then, then I would lose peripheral vision. And then I would actually lose sight in this eye and then lose feeling on this side of my body. Yeah. And then my brain would stop being able to do rote things. So at the time I was working nights and things, you know, I had things that I did it was the same rote thing that I had to do day in, day out. And when that headache was coming on, I could not remember how to do it. Like things that I did on automatic, I just could not remember how to do it. So I would literally have to wait until all of those symptoms subsided. And then I could remember again. Yeah. But then now I'm dealing with Yeah, now I'm dealing with a full-blown headache. Yeah. So, and then with her, of course, because of the migraines, I'm throwing up. So with her, it was just like, what the hell is this? Like the boys were so easy. I'm just like, oh my gosh, is this a foretelling? Is this a foretelling of what's coming? But I came up with a theory. I came up with a theory that with the boys, you know, you're dealing with testosterone. Right?
Mm-hmm.
They have the estrogen, they have the testosterone, and everything sort of remains balanced. However, when you have girls, you're dealing with more estrogen. So I always I just had this theory that with more estrogen in my body, you know, it just created some other dynamics. After Rain, I had another boy, nothing, perfectly fine, no migraine headaches, no nothing. It was great. And I got pregnant with London. Boom. I mean, I didn't have migraine headaches with London, but her pregnancy was challenging. So my boys were real easy, and my girls were just like, oh God.
And I had like a never-ending cold. I mean, like my nose was always running with her.
Just their pregnancies just felt like my boys just felt easy. It just felt like, oh, I'm just like I didn't waddle or anything. With the girls, it was just like I felt like death warmed up. It was just
And my husband thought I was a little bit meaner with the girl.
I was definitely meaner with the girls. For sure. And my tolerance and nope, just wasn't not good. Not good at all. But I digress. So walk us through. So you've had your previous pregnancies. Did you take away anything like, you know, from those experiences? You know, baby girl was a surprise. You weren't expecting her.
Mm-hmm.
And at least you weren't planning for her. And did you like have any moments of, okay, so I've had these experiences, I'm going to do this one differently? Did you have anything like that?
I know, well, with her, you know, I was trying to educate myself on trying to see if I can have another VBAC. Mm-hmm. I did go to like a couple of little birthing seminars, and I learned about what doulas were and what their roles were in the birthing process, which, and that's another thing I'll talk about later. In hindsight, I really wish I would have hired a doula. One of the biggest things for me, I wasn't able to exclusively breastfeed my other two. So I was really throwing myself into making sure I was able to exclusively breastfeed her. And because, you know, when I got pregnant with her, excuse me for just.
No, you're good. Go ahead. I heard the knock. Oh, the joys of having children and having to flow. It's a part of motherhood.
Yes, he just asked me for some Doritos. Okay.
Okay. Oh, I have to tell you, last week, I'm in the middle of an interview, and I had told my son to put some black beans to soak for dinner. And he's an aspiring chef. He'll be 15 next month.
Oh, cool.
So he comes in, and I'm like, no, I'm still. And he comes in, Mom, something's wrong with beans. I'm like, okay, I'm still interviewing. Just, yeah, but are they supposed to look like this? I'm just like, oh my God. Yeah, can you just wait? Can you just? So he shuts the door, and he's like, yeah, but the beans, are they okay? I'm like, oh my gosh, yeah. So,
did he bring the beans to you?
He did. He bought the whole bowl of beans. I'm like, Sage, all it is it soaked up the water, and that's what they're supposed to do. Oh, okay, because all the water's gone. I'm like, bruh, that couldn't have waited until I was done. So trust me, I understand the Dorito. You know, their emergencies and our emergencies are two very, very, very different things.
Yes, yes.
But yes, please go ahead.
So yeah, I really wanted to breastfeed her exclusively. And because when I got pregnant with her, I was considered advanced maternal age.
Mm.
So, it wasn't necessarily considered high risk, but I had to start going to the doctor. I had to go to like a fetal specialist or maternal fetal medicine every month. Also, I think because I had
I was
had
going to
help.
say, was that because of the help as well? Yeah, you had
Yeah.
help. Yeah.
They wanted to keep an eye on that, and I had to take they had me taking like a baby aspirin daily because of that as well. So I just thought, well, hey, I've had two. I think I can do this. I've already had one successful VBAC aside from everything else. But I could do this. Yeah.
Okay. So you had decided, all right, I want to do a VBAC. Had you made any other decisions about what kind of birth it was going to be?
No, and I really wish that I had like there were a lot of options I could have had that weren't offered to me, or I just didn't know about, or I just didn't ask about. Like I could have because I did do the tour of the hospital and everything like that. But in North Carolina, we don't have midwifery or anything like that, or at least it's not legal. Or well, the home birth.
In North Carolina,
Yeah.
it's illegal for midwives to do home births. Yeah.
Yeah. So I didn't know that I could have like birthing balls or the little peanut ball to help me, or I could wait and walk around because as soon as I got to the hospital, they made me I went to the bathroom. My water broke while I was using the bathroom. And then they made me lay down. And then I was not in the headspace to say no or yes, because I was in a lot of pain. And my husband was scared. And so it was just a lot going on. And I couldn't really advocate for what I really wanted to do.
And that's so interesting because, I speak to moms all the time. And one of the things that, a resounding part of a conversation is after they've had previous births, they feel as though, oh, I've done this before. I've got this. So there's when you talk to them about, educating themselves and preparing, it's kind of like, well, I've done this before. So what more education could I possibly get or need? It's going to birth a baby.
So yeah, I really wish I would have had a doula or something like that to just kind of come in, help my husband be a little, feel a little more assured with what was going on. And and my doctor, and I feel like he was in between two births. So I went in labor and then another labor. So he was pulled in two different directions. And when he came in, because they had given me the epidural, and he was like, well, did anybody check her? And when he checked me, when he came in, he was like, you're 8 centimeters. And I was like, oh shit, if I would have known that, I would have just kept going. I was so close,
Okay, so you opted to get an epidural.
Yes, I got the epidural because I was just hurting so bad. I was just in the moment. I got it, and I wish I hadn't. And then the anesthesiologist, she was so rude. And then she ended up having to do it. I think what was the kicker is that she ended up having to do it again because it wore off. And that's what caused my heart rate to drop and the baby's heart rate to drop. And my doctor got scared and he was like, we got to go. Because he was also scared. He told me later that when he was going in to get the baby, that my uterus was contracting so hard and it was so hard for them to get the baby out. He was scared that it would rupture. I was like, well, had I not gotten that second epidural, maybe things would have been different, or I just don't know, Yeah.
So this is baby number 3. Okay, so you had told yourself you didn't want to do an epidural, but you ended up doing the epidural.
Mm-hmm.
And because of the epidural, it made your heart rate drop, made baby's heart rate drop, which then created a situation for, I wouldn't, did he say it was an emergency C-section, or was it like, just like, okay, let's go? I mean, did it feel like an emergency situation in the hospital?
It's still kind of hazy to me because I was just so tired. But everybody was running around, and so that felt like an emergency. And they told me what was probably going to have to happen, and I think I just felt defeated at that moment, that I just kind of just gave in.
You were like 8 centimeters. You were like right there.
Yeah.
Gotcha. Yeah, and I can see. So how did that play out for you in the big picture of that particular birthing experience with your daughter?
I remember this was where it was kind of traumatic for me, because I think sometime in between during the C-section, I probably kind of blacked out or went to sleep or something. And I woke up and it was quiet and nobody was around me. So I was panicking. I was like, where's my baby? What's going on with my baby? Yeah. Then the little anesthesiologist came in and she was like, she's fine. She's with her daddy. Because from a minute my heart stopped, I thought something had happened.
Of course.
Everybody was so quiet, and all I do remember is waking up briefly, because I had already decided before I had her that I was going to get my tubes tied. I was done having babies. I didn't want to have. So I just remember briefly waking up, telling the doctor, make sure you tie my tubes.
I love it.
I don't remember anything after that. But it was just scary. And then I didn't see her for maybe another hour after that, and my husband was holding her. And then probably we went home. Things were going good. Breastfeeding was going good, but I did not feel myself. I was a wreck. I was anxious. My kids weren't making me more anxious, but being around them, I felt more anxious. And so that's where I called my doctor. I was like, something is wrong. I'm not myself. And I just knew I had postpartum depression and anxiety. Yeah.
How long did your how long did your postpartum depression last for?
I would say maybe about 6 months, where it was pretty heavy. My doc did prescribe me something, because, after I had her, I had to go back to work exactly 8 weeks later. And I really wasn't emotionally ready to go back. And I don't think I would have made it if I didn't have any medication. I probably, at the time. But he also referred me to a postpartum psychologist. So I did go and speak with her once a week for a little while. And then once I was able to get back into a sort of an exercise routine, and I started to safely wean myself off of the medication. So I would still have bouts of anxiety and stuff like that, but exercise helped me to get back on track, and not have to have the medication. I think I was only on the medication for maybe about 3 months.
Yeah. So were you able to breastfeed during that time? Because I know you said that was one of your goals, was because you weren't able to fully breastfeed with your previous births, that the intention was.
Yes.
So being on the medication, yes. Were you able to breastfeed still?
Yes, that medication that he prescribed me, it was supposedly safe for breastfeeding. So I didn't have any issues with that. And I was able to exclusively breastfeed her. In fact, we really just started the weaning process after she turned 1. So I still nurse her at nighttime and at nap times. But we did whole year, full on working mom, all of that.
Wow.
Got through it.
Yeah. Yeah. Awesome. So what do you think were the major contributing factors? I mean, some of it, of course, is hormonal and chemical, and we're not always able to pinpoint postpartum depression. But do you think that there was anything that contributed to that for you?
I think if my birthing experiences was different, I don't think I would have had postpartum depression.
Mm.
I think also the psychologist told me that I most likely probably had peripartum depression before I had the baby. Which I can see that because I was just going through a lot of stress at my job, and just having the type of work I do, I'm always on my feet, like always. So it just, as I was getting heavier and everything, I was just tired. I was hot because she was born in August. You know, so it was just a lot on me, because I had to work. I mean, both me and my husband, we just have to work because we got all these kids, so we can survive. So it was just a lot, and that probably contributed to it. But I know that the birthing experience not going the way I had planned, it was probably, because even now it's still a little bit triggering talking about it a little bit. So yeah.
Okay. Well, thank you so much for being willing to share. So if you could give a mom who is currently pregnant, who's watching your story, and, she is trying to decide, she's kind of in that space of, do I do an epidural? We hear so many scary stories, and the narrative we're giving about birth is not a positive narrative. What advice would you give to her?
I would just say, really just try to educate yourself on all the different ways you can have not necessarily comfortable birth, but a birth in which you don't need outside medications, because I promise you, it will make it harder for you in the end. It will make your labor a longer process. If you can just trust your body. In fact, prepare your body as far as just taking care of your body now before you get pregnant, and making sure you're doing the best you can and take care of yourself, which is, I did try to do that, especially with my second child, because I lost a lot of weight prior to giving birth to him. And ask for all of your options. Don't take no for an answer. Don't, ask them about something they may not have even heard of. Like, one girl I know, she used nitrous oxide to help her do her birthing process, because she didn't want to do the epidural. I didn't even know about nitrous oxide. I didn't even know my hospital. I think they just started offering it. Just don't settle for no. And I know right now during this COVID,
it's
hard. The doulas are kind of having a hard time because of COVID. But I don't know if they can be virtual or anything. Make sure you and your husband or your partner discuss your birthing plans before you go into labor, because in the heat of the moment, it's just so hard not to give in when you're feeling pressure from all these medical professionals that know what they're doing.
Yes.
Yeah, and I work with healthcare, but even still, even as Black women, you can still face discrimination as patients. I've had some CNAs or nurses come in rude and do stuff, not knowing that I'm in this profession. I know what I'm talking about, so you just have to really be a strong advocate for yourselves and just educate yourself, even if you had from 1 kid to 5 kids. No pregnancy is the same.
Yes.
No experience is the same. So just try to educate yourself.
Awesome. I think that's fantastic advice. Thank you so much. I have a question for you. Hindsight always being 2020, and if circumstances allowed, would you have considered a home birth or a birthing center?
I would have. I really would have. Because I have some friends. I have a friend that's in Colorado. I mean, she's had 2 home births. And she did hypnobirthing, and she was comfortable. She was just sitting at home chilling after she had a baby. So I would have really considered it, to be able to have your baby in the comfort of your home where you're not stressed out
Yeah.
about bells and whistles, everything going on, scaring you.
Yeah. Changing shifts, different nurse.
Mm-hmm.
Yeah. I remember that because I 3 of my children I gave birth to. No, 4. 4 of them I gave birth to in a hospital, 1 in a birthing center.
Mm-hmm.
Very, very, very different experiences.
Mm-hmm.
Really different experiences. With the home birth, I felt like I was at home.
Mm-hmm.
Not the home birth, I'm sorry. Obviously, I would have felt like I was at home because I would have been at home. No, the birthing center birth, because there wasn't all of these different individuals coming in, and like you said, the bells and the machinery and the alarms that go off with the different types of machinery, and just the busyness and the noise and the different energies from all these different people who are in this hospital that are complete strangers to you, just strangers. So yeah, that was fantastic advice. And so now you're 3 and done, right?
Definitely. I can't do it anymore. But I'm so grateful that, I was able to have a little girl. I never thought I would. So, and she's a joy. And so I am grateful for that.
Awesome. Well, thank you so much for being willing to share your story and to give fantastic advice. Especially that you said, that some certain parts of the stories for you are still triggering. And so I really appreciate you being vulnerable with us and sharing that information. And I know that your story is going to help some pregnant mom or, a woman preparing to have children, and just hearing your story and, being able to hear your wisdom because you went through it. It's one thing when someone gives you advice and they haven't been through it, but when they give you advice and they've been through it, it gives it credibility. So thank you so much for being willing to share.
Thank you. Now, where can I can I share this interview, or how?
Absolutely. I will. I'll tag you in it. So
okay.
Yeah. So you'll definitely be able to.
Okay.
Yeah. So thanks again, and thank you to everybody who tunes in to. I almost said Wisdom Wednesdays. Tunes into Rebel Queen Spotlight. Definitely, please, if you are not able to catch this particular, okay. See, I was about to say that, and I'm like, that doesn't even make any sense. Yeah. So if you just, just connect with us on YouTube, connect with us on Facebook, so that if you're not able to catch it live, there you go. That's what I wanted to say. If you're not able to catch the interviews live, just know that you can catch the replay. You can catch it on Facebook at The Birthing Code, or you can just go to YouTube and you can catch all of them. And any ones that you haven't been able to see, go and check them out. I've got amazing stories, amazing women, unassisted births, home births, doulas who had home births. Yeah, there's a lot there. I even have a story of a woman who she had she got hit by a car when she was 8 years old, shattered all the bones in her legs and her pelvis, and she was told she would never be able to conceive and have children. Well, she had to. So the stories are just amazing. So please, and if you know anybody who has an amazing birth story, or a birth story that could be helpful to just educate and give people a different perspective, please reach out to me. You can send me an email at nikki@thebirthingcode.com, or you can DM me on Facebook or Instagram. Yes. Okay, so I will see you all next week. Thank you again so much for sharing.
Thank you.
And I will see you guys next week. Have a great, great, great week.
Bye-bye.